What is bradycardia? Bradycardia is a slower than normal heart rate. The heart of adult at rest usually beat between 60 and 100 times per minute. If you have bradycardia, your heartbeat will be fewer than 60 times per minute. Bradycardia can be a serious problem if the heart does not pump enough oxygen-rich blood to the body. For some people, however, bradycardia does not cause a symptom or complication. An implanted pacemaker can correct bradycardia and help your heart rhythm maintain an appropriate rate. What are the symptoms? If you have bradycardia, your brain and other organ might not get enough oxygen, possibly causing these symptoms: near fainting, dizziness or lightheadedness, fatigue, shortness of breath, chest pains, confusion, or memory problems, easily tiring during physical activities. When a slow heart rate is normal, a resting heart rate slower than 60 beats per minute is a normal for some people, particularly healthy using young adult and trained athletes. For them, bradycardia isn't considered a health problem. What are the causes of bradycardia? Bradycardia causes can include heart tissue damage related to aging, damage to heart tissue from heart disease or heart attack, heart disorder present at birth, infection of heart tissue, a complication of heart surgery, underactive thyroid gland, which is known as hypothyroidism, imbalance of chemical in the blood such as potassium or calcium, repeated disruption of breathing during sleep, inflammatory disease such as rheumatic fever or lupus, medication including some drugs for the other heart rhythm disorder, high blood pressure and psychosis, electrical circuitry of the heart. Your heart comprises of four chambers, two upper, two lower. A natural pacemaker situated in the right atrium normally controls your heart rhythm by producing electrical impulses that initiate each heartbeat. These electrical impulses travel across the arteria, causing them to contract and pump blood into the ventricle. Then these impulses arrive at a cluster of the cell called atrioventricular AV node. The AV node transmits the signal to a collection of cells called bundle of HIS. These cells transmit the signal down left branch serving the left ventricle and right branch serving the right ventricle, which causes the ventricle to contract and pump blood. The right ventricle sending oxygen poor blood to the lungs, and the left ventricle sending oxygen rich blood to the body. Bradycardia occur when electrical signals slow down or blocked. Sinus node problem. Bradycardia often start in the sinus node. A slow heart rate might occur because the sinus node discharge electrical impulses slower than normal. Pauses or fail to discharge at regular rate. Discharges and electrical impulses that block before causing the atria to contract. In some people, the sinus node problem results in alternating slow and fast heart rate. Heart block, atrioventricular block. Bradycardia can also occur because electrical signals transmitted through the artery aren't transmitted to the ventricle. Heart blocks are classified based on the degree to which the signal from the artery reach your heart main pumping chamber. First degree heart block. In the mildest form, all electrical signal from the artery reaches to the ventricle, but the signal is slowed. First-degree heart block rarely causes symptom and usually need no treatment if there is no other abnormality in the electrical signal conduction. Second-degree heart block. Not all electrical signal reach the ventricle. Some beats are dropped, resulting in a slower and sometimes irregular rhythm. Third-degree heart block. None of the electrical impulses from the artery reaches the ventricle. When this happens, a natural pacemaker takes over, but this results in slow and sometimes unreliable electrical impulses to control the beat of the ventricle. What are the risk factors? Age. A key risk factor for bradycardia is age. Heart problems, which are often associated with bradycardia, are more common in older adults. Risk factors related to heart disease include high blood pressure, smoking, heavy alcohol use, recreational drug use, psychological stress activity. What are the complications? If bradycardia causes symptom, possible complication can include frequent fainting spells, inability of heart to pump enough blood, sudden cardiac arrest or sudden death. Prevention. The most effective way to prevent bradycardia is to reduce your risk of developing heart disease. If you already have heart disease, monitor it and follow your treatment plan to lower your risk of bradycardia. Prevent heart disease. Treat or eliminate risk factors that may lead to heart disease. Take the following steps: exercise and eat a healthy diet. Maintain a healthy weight. Keep blood pressure and cholesterol level under the control. Don't smoke. If you drink, so do in moderation. Don't use recreational drug. Manage stress. Go a scheduled checkup. Monitor and treat existing heart disease.